From the Commodore Perry Quarantine Studios. I think it's day 8 of COVID-19 and probably about day 10 since exposure, if I had to guess. I'm Scott Sands. Eric Zgodzinsky from the Toledo Lucas County Department of Health is joining us on this afternoon show. Eric, it's great to see you. We're doing this on Zoom, so part of this will be available at WSBD.com as well during the show this afternoon. Nice to see you. How are things at the health department this afternoon?
Well, first off, Scott, it's good to see you, and I'm glad you're feeling okay. We are ramping up again. We're experiencing that fourth wave like others are in the state and in the country. So we're just preparing for what might come.
Yeah, and first of all, you may see my cat Tiger producing the show today. He keeps hitting buttons. Since it must be you, he was quiet earlier, and now he's jumping on everything. Are there a lot of these breakthrough cases like mine that we're seeing, not just in Lucas County, but around the country right now? I think I sent you a note last week that at the urgent care, when I went to get a PCR test, the nurse said that she had tested 29 vaccinated patients the day before, and 17 came back positive. That to me seems like an awfully high number.
Scott, we are seeing the cases like you presented, where you've gotten vaccinated, you get some symptoms, you might not feel too good, and you've tested positive. The definition of a breakthrough per CDC is you present to the hospital or unfortunately you pass away. That's what they consider a true breakthrough. What you're experiencing is what the vaccine is meant to do. It's to keep you out of the hospital. And yes, unfortunately, with the Delta variant, individuals are getting much more virus particles that they can expel over the other variants. That's a little concerning, but again, we are seeing what the vaccine is supposed to do, and that is really to keep people out of the hospital.
And that's one of the biggest questions that I've had asked of me in the last week on social media is are you glad you got the vaccine, even though now you're sick, or would you have gotten the vaccine knowing that you would still get sick? And I think the answer has got to be, yeah. I mean, obviously, I'm not the biggest pillar of health, certainly comorbidities here. But I think that because I was vaccinated, my symptoms over the last week have been extremely minor. At worst, I slept a little bit more than usual, and I love to sleep, so that's fine. A little bit of a loss of appetite. My voice is kind of hoarse over the last couple of days, but that's really it. And when you compare that to the symptoms that other people I know who have dealt with COVID-19 have had, I mean, it could have been much worse for someone like me.
Again, Scott, as we all age, we all get out of shape, and, we got to all be concerned with that. But you're right. The more comorbidities you have, the more likelihood COVID is going to really negatively affect you. And the vaccine is there to help those individuals to again, stave off severe consequences. What we're seeing right now, and again, I hate throwing around numbers a lot, but what we're seeing right now is 90% of those individuals who are reporting in the hospital, in ICUs and events, have not been vaccinated. And what that's telling me is, one, get vaccinated, because you never know when it might hit you negatively and you have to go to the hospital. But also then too, we know that individuals who have gotten vaccinated, they're much like you, where light symptoms, not reporting in the hospital. And that's what we're trying to do, is keep people healthy and alive.
How are the hospitalization rates in Lucas County right now? I'm seeing pictures coming out of Texas and some other states where hospitals are getting overrun like they were early on in the pandemic.
Our hospital systems here, I'm not going to say that there's nobody reporting in the hospital with COVID, because they are, but we are in really good shape right now for the ability to admit people, do those necessary surgeries, those emergency surgeries, those elective surgeries. We're not hearing of anybody foregoing those right now. However, I would caution all of us, if we don't do what we need to personally to combat COVID in Lucas County, there's a good chance that we're going to see something similar as we're seeing in the southern portion of the United States. I saw an article, and this is unfortunately what I do all the time, is I go home and I just read about stuff that's going on. And there's been hospitals where there's been a waiting list of 20 plus individuals for an ICU bed. Vents, individuals are requesting vents. They don't have enough vents in their state. Pediatric hospitals, are starting to fill up. So all these things could happen here. And this is why I think we're always trying to say, do the right thing, get vaccinated. Yes, mask use is important. Don't get me wrong, but that vaccination is what's really going to get us out of any predicaments.
You talk about mask use. Let's go there for just a second. Your health department yesterday issued not really a mask mandate, but a mask advisory. We were seeing substantial spread in Lucas County, and because of the Delta variant, it's similar around the country. And you're now advising more people, especially in indoor settings, to wear masks. Not a mandate, but what's the real usefulness of masks right now, since we've been away from that habit for a few months now?
We got to remember, the mask isn't to really stop the virus particle. The mask is to stop the droplet that the virus is in. So we know that mask will help us curb, the ability to either get infected or spread the virus itself. So it's important that we understand that. The other thing that's important is that we know when we move inside, less ventilation close together, there's a greater chance for us to spread it if we're not wearing a mask. The idea here then too is with this Delta variant, we know that it's much more infectious than the other variants. Some of the research out there is saying it's as infectious as chickenpox. So the logical thing here is we need to start now, because we know in 2 to 3 weeks we're 2 to 3 weeks behind. So with this disease, so with the things we do now will impact what we see 2 to 3 weeks from today. We know that cases are rising, so let's take the steps right now to curb as much disease in our community by wearing a mask inside. The idea here then too is maybe even when you're in a crowded area outside, you should also be wearing it.
So why an advisory? Do you have the power to issue a mandate? Will you issue a mandate for Lucas County?
No, we unfortunately we do not have across the state local health departments to be able to do that right now. The idea here is the advisory is to really spur people to start thinking about it. We highly recommend, and we advise people to heed the guidelines and the recommendation, that advice to do that. But again, I go back, the tool that we really truly have right now to combat this variant, but those variants that are coming down the pike here, is the vaccination.
So I think, unfortunately, as we see more Delta variant cases and more people getting sick, that may be discouraging people who are on the fence about the vaccine from getting vaccinated, thinking, well, it's obviously not that effective. So I think the fact that we're seeing an increase in the spread is having a twofold effect on the psychology of getting vaccinated.
It's really, it's going to be a lot of research material in the future, not just about the vaccine and everything else, but the behavioral patterns and the ideas and the concepts about hesitancy, getting the vaccine, not getting the vaccine. Wish we had those answers right now. What I can tell you is that, again, getting your vaccine today is going to help you tomorrow, in 2 weeks. Getting that second vaccine is going to even further help you by staving off the issues of COVID. Because again, we know there are significant consequences for many individuals that don't get vaccinated. Even though we're seeing the virus, it still should not preclude anybody from getting that vaccine. I'm little, again, reading all these stories that are coming from the southern states right now about kids, again, getting sick, the pediatric cases, those under 18. We weren't really hearing a lot about that early on, and now we're starting to hear about that. Why is that? And I don't think anybody has a really good answer, but that's something that we should really be thinking about and having some concerns about. If it's happening in the South, could it happen here?
Eric Zgodzinsky from the Toledo Lucas County Department of Health here on the Scott Sand Show. Obviously, one of the big controversies around the country is over whether or not kids should be wearing masks as they go back to school. And there's a lot of conflicting information out there about how effective masks are, especially among the younger children in school, and how susceptible those younger children may be to COVID-19. Toledo Public Schools, other school districts in this area now issuing mask mandates for kids, whether they're vaccinated or not, in schools. And parents are rightfully upset about it in some cases. How do you address their concerns and explain why this is for everyone's safety?
Well, Again, the main concern here is not everybody's vaccinated in schools. I would never think that we would get 100% vaccinated. So you're always going to have some individuals that could go ahead and become infected. Those individuals, let's not even take the consideration that, the kids could run into some severe issues. But if they get sick, but they take it home to mom and dad, grandma, grandpa, those could have a true negative impact on the family. So by wearing the face coverings, you reduce that likelihood of those kids either coming down with COVID and having negative consequences for them, and or bringing that home to the family. And again, if you're looking at quarantine and isolation, the idea here is if everybody's wearing a mask, if you're doing those things, those mitigation strategies, 3 foot apart in the classroom, hand washing, all those things, you have truly reduced your need to quarantine individuals. So again, there's some science behind wearing that mask for a number of different reasons.
And that's really where I've been struggling when we've talked about it from both sides of the fence. I hate these kind of mandates, and I think it should be up to the parents to decide. And as you look at kids, especially the younger they are, they're not wearing the masks correctly to begin with, nor are most adults wearing the masks correctly and cleaning the masks as often as they should. And I question their effectiveness. However, as you look at the spread, I mean, obviously what we stopped doing has caused more people to get infected. What we were doing to a certain degree worked. But the good news is even with the Delta variant spread, we're looking at a number of deaths that's as low as it was in March of 2020. So if there's a positive, it's that we've at least found some therapeuticals. We've figured out a way to keep the most at-risk people in society, the elderly, people with comorbidities, vaccinated and reduce their risk. And those are all steps in the right direction. And I think most of us are tired of the masks. We're tired of isolation. We're tired of closures. And that's the public relations. I mean, let's be honest, it's all a PR struggle to get people to do what's in their best interest for the overall public health. What might be right for me or you could be completely different than what's right for 95% of the rest of the population.
Yeah, Scott, you make a really good point. My message is we need to do everything we possibly can to keep schools open, to keep businesses running, to, again, sitting in my seat, I don't want to see virus in our community. I want to see disease in our community. That's our job. And so we have to do this balancing act by really stressing, hey, these are some things that we need you guys to do as individuals in the community to be able to, again, stave this off. We are going to have cases of COVID in our community. That's going to be a given. But really, to what level? I got to tell you, I spent a couple hours last night and a couple sleepless hours last night looking at some of the modeling coming out of Harvard and some of the other schools, and some of the projections are pretty scary for Ohio if they do hold water. Now, early on, we had some issues with modeling that didn't really, if you would, jive with what was happening in each of the communities. So, again, we don't know where we're going to go, and I would rather do everything we possibly can now to make sure that we limit the virus in our community.
My producer, Tiger the Cat,
saw that,
could be telling me that we're about out of time. But Eric, as always, I appreciate that. I'm surprised Tiger hasn't gotten sick from taking care of me the last week. So, Eric, I'd love to have you back on again next week when I get back in the studio and fully recover from all of this. But it's always great to get the updates from you directly.
Great talking to you, Scott, and I'm glad you're doing well.
Eric Zgodzinsky here on the Scott Stanton Show.